Welcome back to the Morning Bud. Well, even though knowing varicose veins are common in both men and women, it sure doesn't make them any prettier.
No.
And for some people, they can cause pain and discomfort, and they can be a sign of more serious circulatory problems.
We're here with Dr. Deborah Manjoney with the Wisconsin Vein Center MediSpa to cover the best treatment options. Good to see you.
Good morning. Thanks for having me.
And some new things, the best things on the market,
Yes,
right?
That's right. I mean, for the last 15 years, we've been using techniques where we actually thread a little catheter up inside the main superficial vein in the body, if it's not working, to get that to close off, because it's responsible for 80% of varicose veins.
Okay.
So for those techniques, we use what we call thermal techniques, meaning either laser or radiofrequency heat to close the vein off from the inside. And so we needed to use local anesthetic that we infiltrated around the vein in a little sleeve that the vein lies in. However, today there are even more things available, and it's amazing all the different advances that are being made.
I want to get to some of those specifically in just a second, but first of all, symptoms.
Right.
Why do they happen?
Right. Well, symptoms happen because there's not enough drainage of the legs. The veins are carrying the used blood back to the heart and lungs to get recirculated back in the arteries, carrying oxygen to the legs. And so if the veins aren't working properly, then the blood is pooling in the legs, and there's really congestion. They're overfilled, and it's overfilled with the bad or used blood, and that's why people get symptoms. And they can have aching, and they can have fatigue and heaviness, and they can get leg cramps at night, they can get restlessness at night, and they can get swelling in the legs.
So what happens if you ignore it? Because a lot of people say, oh, it's just, it's visually unsightly, but
a couple of different things. If they ignore it and they have swelling, that can lead to more permanent problems where they have discoloration, as not only the fluid is pushed out of the veins, but actually the red blood cells can be too, and so they get discoloration that's permanent. In addition, if the skin gets thickened because of chronic swelling and edema, that's when they can lead to non-healing ulcers. And that's the most critical portion of dealing with vein disease. That's the most serious complication that can occur. One thing that people have to know, though, is if they have really big varicose veins, as men frequently do without getting symptoms, if they later on knock into that vein or hit it if they're active, then that can cause a spontaneous clotting action to happen, and they get a phlebitis or an inflammation in the vein. The vein can actually clot off. It's very, very painful. And if it's connected into the great saphenous vein, that long vein that we usually have to treat, then it can actually become as serious as a deep vein clot.
This is a random question, but I just thought of it while you were talking. You know, a lot of times I've heard people say this when we talk about varicose veins or getting rid of them. Do you need them all? You know, is it bad to get rid of a vein? No,
not if it's not working. If it's not working, you're actually making the circulation more efficient in its drainage by letting just the good working veins behind. So if you're leaving those to empty the leg better, because then they're not fighting that backflow because of gravity, you know, is wanting to hold the blood in the legs. So if the bad veins are gone that aren't working, whose valves aren't working, then the good ones that are working can actually work more efficiently.
So that's okay.
Yeah, so that aching, the swelling, that itchy feeling people get, the burning sensation in the skin, that can happen, and that's a sign that you need to do something. But likewise, if you're symptom-free, it doesn't necessarily mean that you don't have a problem. So as we look at these before and after pictures, talk a little bit about the gold standard as it relates to treatment.
The gold standard today, totally different than what it was 15 years ago, is an endovenous thermal closure, either a laser or radiofrequency to close the vein from the inside using heat. And that's what insurance companies now are totally covering, as long as you meet certain criteria that each individual insurance company sets up for its
wow, look at that.
People. And so now these kind of things are a combination of treatment where we may close the great saphenous vein, but the varicose veins are also big enough that we might need to remove those, and we do that through little tiny needle punctures using just local anesthetic. So in all these cases, people are able to come in, have a procedure that lasts anywhere from 40 minutes to an hour and a half, and walk out and resume normal activities. And that's great. But in order to get approval for those things, they frequently have to wear elastic compression hose for about 3 months. They will have to wear the hose for about a week afterwards. And so now today, the different things that are available, and people who don't have good insurance, who have high deductibles, need to know about these kind of things. There are actually wonderful techniques that we don't even have to use local anesthetic for.
And they're non-thermal as well.
They're non-thermal. And so the latest one is actually injecting a surgical glue inside the vein. We thread a little tiny catheter up, and we start injecting glue, and we work our way down as we're withdrawing the catheter, and it closes the vein in about 10 minutes from top to bottom.
Like super
no anesthetic needed. Kind of like that. I mean, this
then
is
what happens to the glue in that vein?
The glue has a plasticizer in it, which means it makes it soft, so the vein doesn't feel abnormally hard. And eventually the vein just closes off and gets absorbed by the body because there's no blood flow in it.
What about the glue?
the glue just, you know, it's just a small amount of glue, very small amount, and so the vein just contracts down around it.
Huh.
Awesome.
Wow, okay. So insurance then sometimes
doesn't cover some of the newer things. So it doesn't cover glue.
Mm-hmm.
It doesn't cover something in most instances called Clarivein, where we're using a little rotor-rooter type of thing in the vein as we're spinning it around and injecting some
Why don't they
irritant.
pay for that stuff?
Because they're just a little behind.
Yeah.
Yeah.
But it's still a benefit though because it can be less expensive.
That's
you're
right.
saying.
It can be less expensive than going through insurance. So if somebody has a high deductible, or they don't want to spend the time of going through the 3 months of hose and then doing all these things afterward, these are other options that we can offer.
Yeah, because some of these compression hose aren't even required anymore, which is incredible. That's unbelievable. And you can offer all of the treatments available for varicose vein disease, everything that we talked about. And you can check on your insurance coverage too to see what's covered, what's not, and also consider whether or not some of these new treatments are actually more affordable than going through insurance. The Wisconsin Vein Center and MediSpa is located on Georgetown Drive in Pewaukee. Call them right now for a consultation. It's 262-746-9088, WIMedispa.com, and a consultation for varicose veins.
Well, that usually goes to the insurance company. If somebody's coming in without insurance, then we work some, you know, really good deals with people to try to make sure that they aren't paying too much money.
Yeah, get the treatment they need.
Yes.
Thank you so much.
Thanks, doctor.